Welcome to the Scottsdale Vibes podcast. I'm Alicia Haygood. You may know him as a holistic pain doctor, but Scottsdale's Dr. Ashy Goyle believes in healing first, not insurance red tape. From PRP to groundbreaking new programs, he's helping people find freedom from pain without surgery or long-term medications. Huge, huge, huge. We'll talk to him in just a moment, but first, let me tell you a little bit about our sponsor. Scottsdale's own Sean Shackleton has spent more than 25 years helping buyers and sellers make confident decisions. No pressure, just clear advice grounded in real market data. Looking to sell? Sean uses modern marketing and tech to get your home seen by the right people. Looking to buy? She listens first, negotiates hard, and won't let you settle for a home you don't love. So work with a trusted local expert by calling Sean Shackleton at 480-734-7277 or find her on the web at theshackletongroup.com. After training at the world-renowned Cleveland Clinic, Dr. Goyle came to Scottsdale and built a practice that puts healing ahead of anything. He's double board certified in anesthesiology and interventional pain medicine. I have to read this because I will get tongue-tied from all his certificates, degrees, and everything. He has spent many years helping patients truly solve their pain rather than just masking it. Through advanced regenerative treatments like PRP, bone marrow therapy, and a groundbreaking new program, Dr. Goyle is giving patients freedom from pain without surgery, long-term medications, and without the limitations of insurance-driven medicine. So, welcome back to the podcast. I'm excited to have you. Last year, we were hanging out and talking, and we got to learn all about you, your purpose, your passion, how you really got into this by doing residency and just following a doctor like, hey, why don't you try this? And you loved it. Yeah. You found your passion. Now your passion has even grown from just helping patients to really being there for your patients and being an advocate. And that's not working with insurance companies all the time. And I love that because you are putting the purpose first. And that's what we loved about you last year. So talk about that and why you as a doctor for your patients really took a stand for them, I feel like.
Yeah, well, Alicia, thanks so much for having me here again.
Always.
It's truly a pleasure
It's
and
fun.
an honor. So, as you stated, my background is anesthesia, interventional spine and pain. My practice has evolved into a regenerative medicine practice. So what that means is I help people heal their body, joint pain, back pain, spine pain, with natural means.
Okay,
So,
what does natural means mean?
Yeah, so that's a great question.
Because do I find a cocoa plant outside and rub it? Like, what is it? Maybe.
Maybe. Well, so I believe food is medicine.
Oh, yeah.
So that's the foundation of all health. What we eat creates every cell in our body. It nourishes our joints, our cartilage, our tissues.
Yeah.
So food is medicine. So that's where we start.
Okay.
That's all foundation. And then sleep. Incredibly important. Sleep hygiene. Most of our body repairs itself while we sleep. Mm-hmm. So if we're not getting good, deep, restful sleep, adequate sleep, we're not healing our bodies. It's also when our stem cells are being manufactured in our bone marrow.
Okay,
So,
during sleep.
During sleep. So if we sleep well, we have increased production of stem cells, which means our bodies are going to heal better. So it all starts with that. So that's what natural is, right? Sometimes that's not enough, though. And when it's not enough, I can harness the body's healing abilities, concentrate growth factors, proteins from your body, stem cells, and put those back into areas that you need them. For example, if you have knee pain, knee osteoarthritis, that can be debilitating for some people. We have natural solutions for that. You know, the traditional model is do physical therapy, which I'm a big fan of. Physical therapy is everything when it comes to physical issues with our body.
Yeah.
We need to work on mechanics, strengthening our joints, our muscles, so everything works properly, right? Mm-hmm. When sometimes that's not enough. In the traditional model of medicine, you'll get a cortisone shot. Cortisone's great for relieving pain, relieving inflammation, but it's incredibly toxic to our tissues. So
it's like it's a Band-Aid is what it is.
It's a Band-Aid,
right?
yeah. And there is a place for it.
Yeah.
Like if you're miserable and you can't function.
If you can't do PT because you're in pain, like
exactly.
Okay.
That's a great use for that type of a medication. But some people become dependent upon it, right?
Okay.
It's what insurance covers. It's what our system has dictated to us. Like, get steroid shots. You know, it'll mask your pain. You'll be able to function. But what people don't realize is it's causing a lot of harm. It's causing damage to our joints, damage to our spine, and it's actually accelerating degeneration. So
not helping, hurting worse.
And that's how our system is set up. It's episodic symptomatic relief.
Okay.
Right? So people come in when they have a problem, right? And you get the symptoms of the problem treated.
Right.
Thinking you're actually healing the problem when you're actually not. So this was the dilemma I faced. So 10 years into my practice, I began private practice pain medicine in 2007.
Yep.
Like you said, after training at the Cleveland Clinic with some of the top pain docs in the world, I was really good at masking symptoms, and that's what we learned there.
Yeah.
We thought we were doing root cause, like, oh, this slip disc hitting a nerve, that's the root cause. So let's put steroids there to shut the signals off. It was all about shutting off the signals, right?
Interesting. Yeah. I mean, it makes sense. It's all you know at the time, right? Yeah.
So it's modern medicine, which is great. It works really well for that purpose, but it's doing nothing to preserve joint or spine health. I realized this 10 years into my practice when I was seeing clients that I was taking care of, and 5 years later, like I was managing their pain really well, but we get a follow-up MRI and their degeneration has increased. It's gotten worse, exactly. So their disease
Way to go,
is progressing.
doctor.
I know, but that's how our system is set up.
I know.
Mean, no one taught me about spine health.
Agreed, yeah.
No one taught us about joint health. I ask my orthopedic colleagues all the time. I'm like, are you educating people on how to preserve joint health? It's like, most aren't. They're like, oh,
Even
no,
today?
I'm looking for things to cut out or go do physical therapy. If that doesn't work, I'll cut something out and repair it, right? But it's deeper than that. Mm-hmm. We need to nourish the tissues that are there to support a healthy joint. Same thing with the spine. So after 10 years of practicing traditional pain management, I went to a conference and I learned about regenerative medicine. And it really changed my entire mindset.
Yeah.
Here I was at this conference and I was learning that the body has the ability to heal itself. And everything I had been doing with these destructive procedures that mask pain really well are doing harm, right? And we take this oath to do no harm. So
it hit you hard.
It hit me really hard.
Yeah.
It changed my entire mindset in medicine. It actually helped me find my passion for medicine again.
And
I'm like, oh my gosh, I'm going to dedicate my career, my passion, and my life to this. And that's what I did. So I took a deep dive into regenerative medicine, learning how the body can heal itself and how we can harness that ability, right? And luckily, I'm interventional spine trained, so I can take stem cells, I can take platelet-rich plasma, your growth factors, your anti-inflammatory proteins, exosomes, and I can put those back into areas that you need them, including the spine. And so we can help the spine heal.
Yeah.
And we can also we can change the environment in the spine to one that favors more health.
That's crazy.
Yeah.
I think we forget, we're so caught up in modern medicine because it's so amazing and how we've come along and stuff like that. But at the same time, you don't know the long-term effects of things. So it's all creative and fun, but we're going back to the basics of what our body was created to do, which was to take care of itself in this way. You went to this conference, completely flipped you. Now you're ready to go. What was the first step you came back home and changed?
Yeah, great question. So first thing I did was I started taking ultrasound courses because a lot of what we do with pain management is based on x-ray.
Okay.
But with ultrasound, you can see tendon injuries. You can see soft tissue. So with an x-ray machine, you can only see bone.
Yeah.
So I can't see if there's a tendon issue. I can't see the meniscus, ligaments. So that's a big part of regenerative medicine is learning how to use an ultrasound machine to find these subtle injuries, if you will, these tears on the tendons, these tears in the ligaments, and address those. So I started taking ultrasound courses. And then I started doing reading the studies, taking a deep dive into what PRP is.
What is PRP?
So that's a great question. Let's talk about that.
Yeah.
So PRP stands for platelet-rich plasma.
Okay.
So what does that mean? So basically in our blood, we have platelets, right? These platelets have a number of functions. One main one is to stop bleeding.
Okay, yeah.
But beyond that, there are these little cells that contain tons of growth factors and things that help tissue repair and heal themselves. So when you cut your finger, for example, you bleed.
Correct.
The bleeding stops. How does that skin magically close up?
Again, the body's doing it by itself.
The body's doing it by itself,
up
exactly.
So I don't have to see or learn.
Right on. Well, the platelets play an intimate part of that. They release these growth factors in areas of injury, wherever they're drawn to, and those growth factors call stem cells to the area.
Yep.
So they kind of serve as a summoning signal, if you will, and a homing signal. The stem cells come to the area, and they cause the tissues locally to divide and heal, and the wound closes up. So that's the basis of platelet-rich plasma. We concentrate these platelets to a very, very high degree, more than what's normally floating around in our body. And we do that by taking blood, just a simple blood draw.
Yeah.
We put that blood sample in a centrifuge, spin it really, really fast, and what happens is it separates out the components of the blood. So you have platelet-rich plasma in one layer, and then above that you have plasma.
I've seen something like this. When you give blood, they kind of do something, right? They can do something to separate it sometimes.
They sure can. Yeah. Sometimes the tubes have a gel separator that will attract certain proteins or cells to the gel.
You're talking about.
Yeah, so it's very similar to that, but we use a centrifugation for this. So it basically spins around really fast and things separate out. And then we can concentrate the plasma that's platelet rich. So what that means is we have a much higher concentration of platelets in this small volume of blood, of plasma, than we do floating around in our body. So I can take your platelets from, let's say, a couple 100,000, which is normal, to billions. Wow. And then we inject that back into areas of injury. Knees.
Oh, so it's more quicker.
Exactly. It actually helps the body heal and recover. And it's profoundly anti-inflammatory, so it can relieve pain and inflammation.
So it's a cortisol shot, and it's helping itself.
Exactly.
All from your own stuff.
All from your own stuff, yeah. And if it's more advanced, then we'll take bone marrow stem cells.
Okay.
So we have I know, it sounds terrible, but
it does.
Yeah, I've done a lot of these. No one has ever complained. No one has ever complained about pain from where I take the bone marrow.
I trust you.
Yeah. Yeah.
But and it does the same thing. It's just a deeper dive.
Yeah, it's just a deeper dive. Okay. Exactly.
So we have PRP, bone marrow therapy. We talked about. What are some other things that you are finding? Let's start at the beginning. Actually, I'd like to ask this. When a patient comes in with diet, exercise, and sleep, how do you start with those 3 questions with the client?
Yeah,
or a patient, I should say.
Yeah. So someone comes in and they're asking, like, let's say they have back pain, chronic back pain. Like, look, I've been doing physical therapy. I'm still working out, but the back pain's getting in the way of me playing golf or pickleball, or even picking up my kids off the floor. Or they go to bed, they wake up back stiff, sore. So I'll ask about diet, because so many foods are pro-inflammatory. Processed foods, sugar, alcohol. So I get into a deep dive with all their basically food nutrition. And then based on that, I'll make recommendations, appropriate supplements, or just even simple changes like, hey, cut that out. You got to stop eating it because it's contributing to your back pain. It's like, it's a choice people make, right? Always. So it's either live with the pain or change what you're doing about it, right? Because I'm not about masking the pain, right? That's traditional pain management. You can eat what you want, live your lifestyle. However unhealthy it is, we'll do these cortisone shots, which will mask your pain. You can keep on living the way you are. Then in 5 years, you'll have really bad degeneration. Then you get a spine fusion.
Yep.
Right.
And you come back to me, and I'll help you with that. Right?
Exactly. Or I'll try.
Yeah.
Ideally, I want to see people before they have their spine fusion.
Absolutely.
It's all about prevention, right? So we'll start with diet, and then sleep hygiene is incredibly important. I always ask people about sleep. A lot of people are now wearing Oura rings, right? So they're tracking their sleep, which gives us a lot of good information. So I'll ask about sleep and what they're doing to better their sleep if they have poor sleep. If they're really bad, then I'll refer to a sleep medicine specialist because I really believe in collaboration.
You walked right into my next question. You aren't the one for all, and you preach this to your patients. Like, this is my specialty, but I use my community for others. So you really do partner with other doctors in the area like you that have different specialties when it comes to nutrition, sleeping, physical therapy, and all that. Yeah. Talk about the whole package, because that is whole health for us these days. And that is regenerative medicine these days, is they have that community.
Yep, and physical therapy is regenerative medicine. Yeah. Stimulating your body to heal itself through physical movement. We have additional modalities like shock wave, something called photobiomodulation, which is like red light therapy or laser light therapy. There's hyperbaric oxygen therapy that works really well for some people. But it's networking with all these people. I've got a great team of people. I tell my clients it takes a village, right? It really does in anything we do, right? And so I'm blessed to have these amazing connections with the top physical therapists in the Valley, internal medicine specialists, functional medicine specialists, naturopaths, chiropractors. Yeah. And we all work together, personal trainers. Yeah. We all work together. Nutritionists, yeah. So, it does. And so my job is to help people figure out what they need. Yeah. Right? I mean, the biologics are just one part of what I do, right? Some people come to see me and it's just me getting them to the right place. Right. Yeah, and finding the right team and saying, hey, go do that for 3 or 4 months. Let's optimize your overall condition, and then we'll come back and reevaluate. And if we need to do biologics, then we can do biologics. You did the traditional medicine, you're in regenerative now. What have you seen as a doctor with your patients, the difference between the two when it comes to healing and time? It's a great question. So in the past, it was quick episodic care. People would get relief within a matter of days to weeks. Now it's a whole different story. I tell people we go on a journey together. Okay. So when we start this process, my goal is for you to be better in 1 year from when you cross paths with me than if you hadn't crossed paths with me. So it's a journey we go on together, and this is concierge level service. When people see me, it's an hour consultation. Yeah. They're getting direct access to me, usually via email or even my cell phone number, and we go on this journey because it's going to take time. For the body to heal and repair itself, it just takes time. Well, and you have to be reminded too,
it took time to make that injury, right?
Exactly.
Like it
Yeah.
didn't just, unless it's a broken bone.
Oh, yeah.
That kind of thing.
Yeah.
So it makes sense. It's going to take time to heal.
Yep, exactly. Or like, I've got a buddy who injured his shoulder doing jujitsu.
Yeah.
We were able to do 6 sessions of our high-powered laser, cured.
That
He's
high
like,
power laser is a game changer. It fixed my shoulder.
Really is.
Yeah.
Yeah.
Like I had I dislocated it snowboarding, didn't go to the doctor, PT, it healed itself incorrectly.
Yep.
And the red light therapy was that laser. Red light
yeah.
laser was the game changer for me after everything.
Yeah, it's amazing how it works.
Yeah.
Yeah. Increases blood flow, stimulates cells to turn over.
Yeah.
Can actually promote tissue repair while reducing pain and inflammation.
I had done 2 rounds of physical therapy. It had been 2.5 years. I did 6 sessions of that red light laser, and I haven't had pain since.
It's amazing. Yeah.
It's crazy.
Right. And it's like just your body just using light therapy.
Yeah.
Yeah. Because we need light. So
And we have a lot in here, just the right colors in here. So,
Yeah.
so continue on though, like how you've seen the patients change in this journey that you're going to take them on.
Yeah, so it does take time, but I like to use this story of an 87-year-old gentleman who came to me in sometime like mid to late 2021.
Okay.
And I had met him a couple of times in my last practice. So I opened up my own practice in 2021,
Right.
Integrated Spine Pain and Wellness. So and that was a focus on holistic medicine and regenerative medicine. So he followed me to my new practice. I hadn't seen him for a couple of years, but he's like, "Hey, Goyle, I'm 87 now, right?" He's like, "I'm in good shape, but I got knee pain, hip pain, shoulder pain, neck pain, and back pain." And he's like, "I'm going to be 90." He's like, "My heart's good, my organs are good, everything else is good. My mind is sharp." He's still running a big, huge company.
Yeah.
Yeah, he was a Fortune 500 CEO back in the 80s. So
Amazing.
he's like, "That keeps me going." He's like, "I need to run businesses." He's like, "That's what I'm good at. It keeps me young in my mind," but he's like, "My body's starting to catch up." He's like, "I want to be better at 90 than I am at 87.
Love it.
And so we went on this journey together. There was some biologic therapies, PRP, bone marrow stem cells. He did the light therapy, hyperbaric, tons of physical therapy. Like he was committed to the physical therapy. He gave up drinking, which is incredibly
Huge.
important. Yeah, which is really impressive. Yeah, because he's like, "I like my wine." I'm like, "Well, let's go through this. But if we're going to do these biologic therapies, I need you off wine because alcohol is a stem cell killer." And so he agreed to that, and he just never started drinking again. He just stopped. But anyway, at 90, we got him going up and down Camelback 3 times a week.
Holy cow.
Yeah, so he's better at 90 than he was at 87. He came back and told me, he's like, "I'm better at 90 than I was at 87.
It worked.
It worked, yeah.
But he took the time to commit to everything.
It took time, yeah. At 88, he was a little bit better. 89, he was getting better. And then by 90, he was really happy with the progress we had made.
That's fantastic.
Yeah, but that's the kind of stuff we can do. It's all about really just being committed. It's a program. It takes time. It takes a team, and it's participatory. So it's personalized and participatory. Those are the 2 most important things with this type of medicine.
Personalized, participatory. Those are tongue
Yeah, I know they
twisters,
are.
right?
Yeah, glad you got tongue-tied.
Yeah, great. You can only do that by doing it your way and not working with the insurance and going that concierge route.
100%.
So it is important to me because I think that we are not being our healthiest versions because we don't know how, because we're told how and where to go for doctors and what to do. So talk about what the importance of this concierge level is and how we can only do it with, doctors like you taking a stand.
Yeah, unfortunately, insurance medicine. So when I started my practice.
And you were in insurance. I mean, you dealt with this.
Yeah, I was in it for 14 years before I started my own practice. But even when I first started my practice, it was heavily insurance based, right? And what was happening is I was spending 20, 30 minutes with each client, and it's not sustainable.
Right.
Like in an insurance-based model, the reimbursement is so low, and you're not guaranteed to get paid for your office visit or anything you do. Right? So most people make that up with volume, seeing 30 to 40 people a day. And it's happening right now. I had a new consult today. Spent an hour with a person. They're like, "My last pain doctor spent 15 minutes with me," and it wasn't even the doctor; it was the nurse practitioner.
Right.
The doctor popped in, shook my hand, and said, "I agree with the plan," and walked out. "I'll see you for your shot," and that was it. I'm like, "Well, it's not their fault.
Yeah,
That's just how the system is set up."
I know.
But to take a deep dive into people's sleep, nutrition, their biomechanics. I mean, my exams are pretty thorough. Like I examine people head to toe, because you might miss something. Like I saw a guy today who's seen 3 other pain specialists in town, an orthopedic surgeon, and no one looked at his hip. And he's got pretty debilitating back pain, had all these procedures done that worked temporarily, but never really got him. He's like, "I think people are missing something." And so I examined him, and it was a hip issue. I'm like, "Well, get an MRI of your hip. I think you have a labral tear."
Dang.
Yeah. But I mean, that's the kind of thing you can do when you have time.
Yeah.
But in a 5-minute, 15-minute consult, you just don't have time to do that.
That's fair. Yeah.
Yeah.
And it's like you said, it's not the doctor's fault. It's how it's set up.
It's just the system.
The
system is really broken.
Yeah.
Yeah.
So concierge level with you, Dr. Goyle, what does that look like? You come in, like you said, you get that hour-long consultation.
Yeah.
You have access to the emails and stuff. Like, what is that relationship and that look like to go into this journey with you?
Yeah. So, I mean, I believe like all the clients I see are family. So, and some have become my really good friends.
Yeah.
But what I'm doing is very intimate, right? And even when I was doing traditional pain management, I feel like spine injections are super high risk, right? People are putting a lot of trust in us to do these procedures. And I take that very seriously, right? And now I have the time to honor that and respect that to a whole new level. And so when people are putting their trust in me, I want them to know I'm with you on this journey.
Yeah.
And so that's a concierge level service. Like people can text me, they can email me anytime. We make ourselves available for them. You know? And that's what it's about. It's about supporting people on this journey because it's different for everyone.
Yeah.
We don't know what it looks like.
Yeah.
It's not predictive, unfortunately.
Yeah.
But it is, but it's all personalized. Like I tell people, I never do the same thing twice, but I'm with you along the way. My staff is amazing.
Yeah.
You know, I might be a little biased, but I feel like
They
I'm
are.
really blessed.
I'll be biased with you. I've met them all a
Thank
few
you.
times. Yeah.
Yeah, I feel like I'm really blessed
You
to have
are.
the team that I do have.
And that
Yeah.
speaks volumes, I think, to who you are as a leader, as a doctor, because that's who they want to work for and believe in you, which is regenerative medicine. Where do you see it going in 5 to 10 years?
I think it's going to continue to expand. I mean, I think this is the future of medicine if we can get big pharma out of the way, and you know, some of the surgeries. I mean, a lot of our healthcare system is driven by surgical interventions, right? And it's the device reps and you know the hardware and all that kind of stuff, right? I think we've got to change the foundational health first. I think food is the number one thing. That's the most important thing, and then really working on stress reduction, which is. I mean, I know, right? I know. I'm trying to do that too. Like,
Oh man, that's funny, but yes, I mean it's true. It really is sad and true.
It is, yeah, because we're all in such a sympathetic.
Yeah, I just like had to drop my shoulders when you said that. And I was like, what am I sitting like?
Right. Take a deep breath.
Yeah, I did. Yeah, it's funny.
But you know, I think the future of medicine is harnessing the body's ability to heal itself. Right?
Yeah,
and I think it's preventive. I think that's the big push. We're going to see more preventive care. Because people are catching on, you know, it's like they don't want to have a knee replacement in 10 years. Right. So what can we do now? Like I'm starting to see people in their mid-20s.
Okay, this is what I was going to ask you because you talked about eating better, the no drinking. You're seeing this younger generation be that generation.
Oh, yeah.
They are drinking less than any generation ahead of them. They're eating healthier. They're eating more organic. It's funny because they're living a healthier life than, you know, their parents and grandparents kind of thing. I'm interested to see how you are seeing these patients and them coming to you now to prevent seeing what their parents are going through and stuff.
Yeah. So a lot of my clients in their mid-20s to mid-30s, they're executives, they're professionals, and they've done their research. They're like, hey, I heard that PRP can prevent the breakdown of cartilage. I'm like, absolutely can. We've got great studies that show that a PRP treatment inside a joint can prevent loss of cartilage.
Yeah.
I tell people, what's more anti-aging than preventing wear and tear of your body?
Yeah.
Well, now we have tools that if they can't prevent it, they can slow it down significantly.
Yeah.
And so a lot of these people come to me and they say, hey, look, you know, I play golf. I got some back pain, a little bit of hip pain, not debilitating. I can work through it. I got an MRI, full body MRI scan. There's some degeneration here, some degeneration here. Would I be a candidate for some of these treatments for prevention?
Yeah.
I'm like, absolutely you would. Like, why wouldn't you? I mean, if you have access to this technology, that was like
lightning and thundering here in the studio. Just totally scared me. I jumped.
Yeah, it was a big crack of lightning back there.
Glad I didn't see it. That's funny.
But yeah, I mean, you know, that may be a little controversial, but you know, if it's done safely under sterile conditions, you know, you reduce the risk of infection. I think it's a great option. I can give myself as an example. So, I've got a bad left knee.
Okay.
I used to lift,
From what?
Well, did a lot of things. So I started wrestling when I was 13.
Okay.
And I started lifting weights when I was 13, but no one taught me how to lift weights, right? So I lifted weights on my own, all through high school, through college, through med school, got hardcore into racquetball. And then in 2008, my knee got so bad that I had to give up racquetball, right? And I gave up running and hiking. I just moved to Phoenix, and I did a couple hikes, and my knee was,
done.
I did Piesto Peak. And for a week, I was like limping. I was like, okay, I cannot do that anymore. So,
and you're like in the pain management.
Oh yeah,
I mean, this is your field.
I know, but I knew enough that I didn't want to put cortisone in my joint. So I was like, I'll just modify my workouts, modify my lifestyle.
Yeah.
So I gave up racquetball, stopped lifting stupid heavy weights and stopped hiking. I found other ways to keep myself healthy. But it wasn't until about 2010 when I worked with a chiropractor who happened to just examine my body mechanics. And he's like, here, stand up straight. I'm like, I am. He's like, no, you're leaning over to the left. And he put me over just straight, and I felt like I was leaning over to the right. I'm like, oh, I probably did this to myself, working out, leaning on the left side, just loading this joint. Yeah.
I'm literally in physical therapy right now. I have like 2 sessions left for the past 3.5 months from doing the same thing that I hurt my back.
Yeah.
From doing it because I didn't realize it. And I was doing the same thing when I was walking. The physical therapist like, you're not even walking straight. I was like, I feel like I am. She's like, your left hip just keeps dropping like this. Yep. So we've had to do a ton of like internal core stability work.
Exactly.
And but it was all because I thought I was doing everything fine, and it wasn't.
That's why I'm a big fan of personal trainers. Having someone watch your form, make sure you're doing things correctly.
That's where I'm at now.
Me too. I work out with a trainer. I mean, I don't think I do any workouts unless Nikki and I are traveling. I'm always working out with a personal trainer.
And that's what happened this summer. I was vacationing and working out, and that's when I did it when she wasn't there with me. See, of course,
right.
But it is. So you worked on your own knee.
Yeah. So what happened? So when I discovered regenerative medicine, I'm like, great, this is what I want to do. So I started doing PRP in my knee, not myself.
Okay.
I hate needles.
Okay,
I don't mind if they're going away from me, but I get a little freaked out when they're coming towards me. I know.
You have no problem putting them towards someone else.
No, I have no problem at all. I actually enjoy it. Yeah, it's like my art. It's my craft. It's meditative for me. It's like I love it. I just love it.
You have to, because you're focusing in. It gives you something to dial in on.
Yeah, that's amazing. I love the accuracy. I love the precision. Yeah, that part is fun for me, and knowing that I'm helping people too.
Yes.
But when they're coming at me, I freak out a little bit. So
funny.
I've had a few done on my knee. I'm 100% pain free now. My last shot was 2.5 years ago.
Wow.
It's working great, but I also put it in my healthy knee.
To see the difference?
Well, the healthy knee is healthy.
So just
to preserve the cartilage.
Okay.
Yeah. I had a little bit of degeneration, so I was like, let's just put some in there.
Yeah.
Did a follow-up MRI, it stayed the same. So the degeneration hasn't worsened in either knee.
Yeah.
And I'm squatting, I'm lifting weights, I'm doing all the things that I love to do.
Yeah.
And heavy weights too. I was just squatting or leg pressing like 415 pounds.
Yeah.
So
good for you.
Not bad. Yeah. For having a bad knee, I think it's pretty darn good.
Well, you used to have a bad knee, as you just said.
Exactly. Yeah.
Scottsdale's always at the forefront when it comes to new age, when it comes to anything med spa, health, wellness, and stuff like that. We're very healthy sitting and take it seriously. So where do you see this rejuvenation health building in Scottsdale really to be a leader in this for the world, society at least?
Yeah. No, so I mean, one thing I love about Scottsdale is the focus on wellness. Especially the community that we're attracting into our practice.
Right.
Everyone's preventive. They're like, look, we see what's happening to our parents or what happened to our parents, and we don't want to turn into that.
Right.
Yeah. They want to live healthy and well and strong into their 80s and 90s and even to 100.
Yeah.
Like, who wants to be 90 and debilitated, right?
Nobody. No.
Yeah, exactly. So people are focusing on skeletal muscle mass, like really building their muscle, which is the organ of longevity.
Yeah.
Like, you need skeletal muscle mass to
hold everything up.
Hold everything up, exactly. To get up off the floor.
Yeah.
Right? Yeah, to get up out of a chair.
Yeah.
So, but I think that I'm sorry, I lost my train of thought.
Where do you think Scottsdale's being a leader when it comes to this in the health industry?
Well, I mean, there's wellness clinics popping up everywhere.
Yeah.
Right? Yeah, you've got red light therapy everywhere, hyperbaric oxygen therapy. And I think with regenerative medicine, though, there's a hole there. There are a lot of people in the community who offer it as a service, but they don't specialize in it. And I think it can potentially do a big disservice to people. I think it's really important to really take a deep dive into this therapy because it's not one size fits all.
Yeah.
And to really understand the nuances of, why platelet dose matters. Like when we do a PRP injection, the amount of platelets we inject matter. If you underdose, you're going to get a lack of response.
Yeah.
So I see people who've had these therapies done, they come in, they say, oh, I've had PRP, it didn't work. Then ask some deeper questions and find out, well, they just didn't take enough blood and get enough platelets. It's not their fault.
Right.
They're just doing what the reps told them to do, right?
Right.
Yeah, the reps from the companies who sell the kits. And that's a bit of a disservice, but when done right, it can really be profound and it can improve people's quality of life tremendously. But I think that's going to be a big part of people's lives moving forward, especially in this town. I think people are seeking these treatments out now, and they want something that's going to promote longevity and preserve their joint health.
So how old are you on paper versus how old are you in your body?
I'm 51 chronologic
Yeah.
age. But the last time I checked my biologic age, and there's no
I know,
solid
yeah.
test to tell of whatever it is, but I'm 9.5 years younger.
That's amazing.
So, yeah.
That's crazy to me.
I do a lot of things, though. So
I know you do.
Yeah. So
Yeah.
I'm really into anti-aging wellness, because the goal is to preserve brain health, number one, but then to preserve physical health.
Yeah.
Yeah.
It's fascinating to me. I love it. Well, you too should go, first of all, get your health check and take care of yourself and go see Dr. Goyle at Integrated Spine Pain and Wellness. He's everywhere. He is all in tune with our community, and that's what we love about him. You can find him in Scottsdale City Lifestyle. He's here at Scottsdale and Shea, and we'll have his information on the description of this website. So thank you so much for joining us. I always learn from you, and I always...
Thanks for having me.
For someone who's not a medical fan, like my kids put their own Band-Aids on when they get like a boo-boo or something, I still am fascinated by learning from you because you dumb it down to someone like me who's not going to read a biology book to make me understand the importance and really the cause and effect of everything and how these simple changes can make such a long-term difference for us in the future. Yeah. So he's here to help us. There is lots of fun going on that you can do without being in pain coming up. But before we do that, let's talk about Jeremy Mueller of State Farm Insurance, our wonderful sponsor. Living in Scottsdale means knowing the value of community, and that's exactly what you get with Jeremy Mueller Insurance. He gives back to the community as his top priority from him and his team. He's been here for over 25 years helping neighbors just like you with home, auto, life, and business coverage. He knows our city, our lifestyle, and our needs. Plus, with 3 local offices, his help is always close by. So give him a call at 480-515-5223 or visit jeremymueller.com because here we look out for each other. Have a wonderful week, Scottsdale. Keep vibing, and I'll see you around town.